The landmarks for the incision are the spine of the scapula, the acromial process, the greater tubercle and the proximal diaphysis of the humerus. The angle for the shoulder arthrodesis is predetermined by observing the normal standing angle of the shoulder in the individual patient. Commonly, the angle is 110 degrees. The foam is incised on the lateral aspect of the shoulder to expose the distal third of the scapula and the proximal third of the humerus. The acromial process is osteotomized in the clinical patient to aid exposure of the joint. The next 3 ostectomies are shown. First, the greater tubercle is resected to aid exposure and provide a flatter surface for the plate. Second, the articular portion of the scapula is resected perpendicular to its spine. And third, when the shoulder is flexed to the predetermined angle, a parallel ostectomy of the humeral head is made. Medial or lateral angulation of the ostectomy is to be avoided. The distal scapular and the proximal humeral ostectomy surfaces are opposed and temporarily fixed with Kirschner wires. An alternative technique is to remove only the cartilage from the glenoid surface and the humeral head. The bending template is used to determine the contour of the cranial surface of the spine and the cranial aspect of the proximal humerus. A 12-hole 3.5 LC-DCP is contoured to match the bending template. The plate is secured to the bone by first placing 3.5 mm screws through the most distal and most proximal plate holes. The K-wires can now be removed. A screw is placed through the scapular portion of the plate into the proximal humerus. If the screw passes through the scapula, it should be inserted as a lag screw. The remaining plate holes are filled. The proximal screws are directed into the thick bone at the junction of the spine and body of the scapula. In a clinical case, cancellous bone is collected from the ostectomized humeral head and placed around the arthrodesis site. The angle of the arthrodesis is evaluated critically.